extremely high levels of blood pressure can cause symptoms such as headaches, dizziness, and rarely can we also get acute strokes in the setting when your blood pressure is really out of control. So hypertension is our medical term for what high blood pressure is. So it's elevated blood pressure. So there is a typical cutoff of numbers that we look at. Typically the current guidelines, which have been updated over the last couple of years, say now greater than 130/80. So that's considered elevated blood pressure or high blood pressure or hypertension now. So the systolic number, which is the top number, that's what they often refer to as the top number. And the bottom number is called the diastolic number. And so they're looking at the pressure difference between when your muscles or your blood vessels relax and contract. And that's kind of what their measurements are. So when we take the cuff pressure through the wrist measurement or cuff pressure, those are the two numbers you're getting at the expansion and the compression of the blood vessels. So there are different categories what high blood pressure is. So normal is now still referred to less than 120/80, and pre-hypertension or first degree is kind of like 120 to 129/80 to 89, and now stage 1 hypertension is now 130 to 139/80 to 89, and then stage 2 is now 140 and above, and 90 and above for the diastolic number. So it's important to look at both of those numbers to kind of see what category you may fit into. So obviously, if your blood pressure is normally pretty high and you take medications, you can often call your physician, hey, my blood pressure is a little bit more elevated. But obviously, anytime when you're having any symptoms of high blood pressure, and extremely high levels of blood pressure can cause symptoms such as headaches, dizziness, and rarely can we also get acute strokes in the setting when your blood pressure is really out of control. So those things to be monitored for. Typically, I recommend my patients when their blood pressure is above like 170s, 180s, at least to contact the physician. If they cannot get access to the physician and certainly have symptoms, go to urgent care or emergency room where they can monitor your blood pressure and maybe give you some medication to lower it safely for you. If the diagnosis of high blood pressure is new, you may need to see your physician certainly a little bit more frequently. And one of the things a physician or a physician's office may recommend is checking your own blood pressure at home. And often when you come back to your follow-up visit, having a log what your blood pressure is knowing is really helpful so the physician can review what your numbers are at home and make adjustments. So sometimes in the earlier stages when you're being new to medications or you're being monitored very closely, you may see your physician every 1 to 2 weeks until your blood pressure is well controlled. And thereafter, if your blood pressure is controlled, may see them every 6 months thereafter, depending on the physician's discretion. In addition to hypertension, often patients may have other risk factors. They may be diabetic, for example. The heart can thicken as a result of the stress of high blood pressure for many years. And initially that's thought to be a good thing, but over time that puts an undue stress on the heart and that can have cardiovascular complications. People can develop heart failure, they can develop coronary artery disease, develop heart attacks as a result of that, and certainly irregular heart rhythms. And as a heart rhythm specialist, one of the things I commonly see is atrial fibrillation, which is commonly associated with hypertension that's been uncontrolled for many years for a lot of our patients. To prevent or reduce or improve your high blood pressure over time is certainly, we talk about the underlying causes. So really addressing what may have caused your high blood pressure to begin with. Certainly if you're very obese or have gained a lot of weight, focusing on weight loss will really help your blood pressure over time. Looking for and potentially treating sleep apnea, reducing alcohol intake. Exercise will help as well too. Regular getting active exercise not only will help with weight loss and things like that, but itself can also help with improving high blood pressure over time. That being said, despite your best efforts, sometimes you may still need medications that your prescriber or your physician may give you to lower your blood pressure and stabilize your blood pressure. And that needs to be monitored and adjusted over time.